Welcome back. I'm Michael Peak. And you know, a lot of people take a lot of things for granted. And one of the things that we take for granted that's so important is our vision, our eyesight. Well, today we're going to talk about a number of different things that you can do to help improve your eyesight. There's this new wonderful book out called Smart Medicine for Your Eyes, written by Dr. Jeffrey Anshel. And Dr. Anshel is with us today. Dr. Anshel, welcome.
Thank you.
So how did you become interested in nutrition?
Well, I was working for a center near San Diego back in the late 70s. And it was a center where practitioners were doing what we call alternative types of healing. And many of them used nutrition in their practices. And I realized that I was probably the only one who didn't have nutrition associated with his practice because I dealt with eyes. But I started to think that maybe the eyes are connected to the body and there would be things that nutrition could be good for as far as the way we see in the health of our eyes. So I started looking into that at that time.
What exactly are you doing today in regards to nutrition?
Well, what I've done today is I incorporate nutrition consulting into my practice, but I've also started what's called the Ocular Nutrition Society. And what we do is we teach eye doctors how to include nutrition as part of their therapy for their patients.
Now, a lot of people have a lot of ideas about nutrition for the eyes. For example, carrots. Why don't you tell me about carrots? Are they good for your eyes?
Everybody asks me about carrots. It's very common. Your mother told you to eat carrots because it's good for your eyes. Well, if you look at it on paper, the beta carotene that's in carrots does convert to vitamin A in the body, if the body is deficient in vitamin A. Well, vitamin A is important for the retina that converts light energy to nerve energy. So it's possible that beta carotene can help improve the functioning of the eye. However, if you are near or farsighted or have astigmatism, things like that, carrots are certainly not going to make any difference.
Tell me a little bit about some of the nutrition that is good for your eyes.
What we're finding is that a nutrient called lutein, which is very prominent in kale or spinach or dark leafy green vegetables, is very good for the eye. It accumulates in the center of the eye and actually helps filter the light so that the retina is not overexposed to too much light.
What are some of your general recommendations for good, healthy vision?
Well, my recommendation on nutrition is pretty much what everybody recommends on nutrition. A well-balanced diet with a lot of fruits and vegetables, moderate amounts of proteins, and on the carbohydrates, some carbohydrates, but not the junk carbohydrates that most of us have too much of.
So there is no one magic bullet.
Exactly. There's no one thing that will actually make your eyes all of a sudden see better, but there's your eyes, again, are an integral part of your body. So it's very important to maintain a well-balanced diet. What we're finding quite a bit, though, is when it comes to eye disease, we're seeing a lot of similarities between, let's say, cardiovascular disease or heart disease and macular degeneration. There's a lot of similarities in the two diseases. We're also finding connections between cataracts and Alzheimer's disease. So the eyes are not only a window to the soul, but they're actually a mirror of the body.
So when it comes to good things, things that you know are good for you, is more better?
Absolutely not. If, let's say, 10 milligrams of a nutrient is good for you, we know that it is, 100 milligrams is not going to be 10 times as good. So it's all about moderation and balance.
Now, you've written this book, Smart Medicine for Your Eyes. Why don't you tell me a little bit about that?
Well, Smart Medicine for Your Eyes is a consumer-oriented book that's geared for everybody to just learn about their eyes in several different ways. In the beginning of the book, I talk about general concepts, how the eye develops, a little bit of the anatomy of the eye, and also concepts of nutrition, homeopathy, and herbal treatments. Also, a lot about how vision develops in children. That's very important.
What are some of the things that parents can do to make certain that their children have good, healthy eyes?
Well, for children, it's very important to get their eyes checked. And most parents don't realize that their children should get their eyes checked by between 6 months and 1 year old. And of course, parents say, well, how can you check a child's eyes that young? Well, there are many objective tests we can do to make sure their eyes are healthy, aligned properly, and there's no excess prescriptions that are necessary to make them see better. But it's important to pay attention to their children's vision because their vision actually develops as they grow. The eyes are mostly fully developed when children are born, but there are some fine-tuning things that happen in those first few years. And those are the things that need to be looked at carefully and monitored to make sure that they're progressing normally.
Tell me a little bit about the overall main core of your book.
Well, in Smart Medicine for Your Eyes, the central portion of the book, the largest portion of the book, deals with several different eye conditions, diseases or different conditions, and what people can do for themselves. It talks about what the condition is, and what the traditional treatments and what some alternative treatments might be, but basically what people could do for themselves to help work with your doctor in resolving these problems. So that's very important.
And is there anything I haven't asked you that you think is important?
I think that it's important that people start paying a little bit more attention to their eyes, and certainly when it comes to computer use, iPods, cell phones, all this stuff, we're looking at digital images more and more and more all day. And actually a study just came out that showed that between 8 and 18-year-old children look at a digitized image over 7.5 hours a day. So that's putting a lot of strain on our eyes. So we need to maintain that health of our eyes and also the comfort of our eyes so we can see clearly in our entire life.
Dr. Anshel, thank you for joining us today. Check out the book, Smart Medicine for Your Eyes. It's available now.